the patients who are very sick will be in trouble because they will run out of money.
It's the world's largest economy, yet tens of millions in the United States don't have health coverage if they get sick. It remains the only industrialized country on the planet without universal health care. U.S. President Barack Obama led an effort several years ago to change all of that. He pushed for passage in Congress of the Affordable Care Act and then signed it into law. Now, more than 4 years later, some Americans say the law they were counting on to help them isn't. Problems are highlighting long-standing issues with the U.S. healthcare system. Healthcare is still a huge issue with voters ahead of the next major U.S. election just 1 week from today. CCTV's Sean Callebs reports in our continuing series, Route 2014.
Route 2014 rolls on into St. Louis, where health care in the state of Missouri is an important issue in the November elections. The Gateway Arch serves as a symbolic gateway to the West, a reminder of the hope and promise the nation has to offer. Abra Fatora doesn't feel either hope or promise. A single mother studying to be a dental hygienist, she lives with her fiance and son.
NCA is here to stay.
Given all the health care debate in the U.S. over the past 6 years, Fatora was stunned to find out she is not covered by the Affordable Care Act, more commonly called Obamacare.
I would think someone who is a mother and is a full-time student, going back to school, trying to better myself, would be covered by the Affordable Care Act, but it was definitely a shock to not be.
Here's the issue. In the U.S., everyone over 65 has insurance through Medicare, and people under the poverty line are covered by Medicaid. She doesn't meet either guideline.
It is kind of strange being the only one in the house that isn't covered.
Nice to see you.
You're nice to see you.
Many patients and doctors, like Harvard-educated Heidi Miller, believe some lawmakers are playing games with U.S. medical treatment.
But if the patient says, I don't have insurance and I only have maybe $30, $40 to spend, and I have to figure out how to take care of them with that tiny little budget, and I can only do an insufficient job with that.
Across Missouri, doctors say there are legions of people who are falling through the safety net. Garage workers, taxi drivers, custodians, hardworking Americans who don't make enough money to afford insurance. But physicians say the crazy thing is, once they get so sick they have to go on disability or be hospitalized, then they're covered. And that, they say, economically makes no sense.
In our country, we have atrocious, embarrassing healthcare disparities. How you live and how long you live depends on where you live and the color of your skin and how much money you make.
I think most Americans believe that guaranteed access to health insurance is a good thing. At the same time, they'd feel less comfortable with this individual mandate, this requirement where our government requires or forces everybody to have health insurance.
Steve Lipstein is the CEO of BJC Healthcare, which runs a number of hospitals and clinics. He says by law, everyone is supposed to have access to health care in the U.S., but lawmakers pushed back. 22 states refused to expand Medicaid. Missouri hospitals are losing $4 billion a year in federal tax money, while most states bordering Missouri are eagerly taking the federal tax dollars. At least one hospital in St. Louis had to close because it lost Medicaid funding.
I think those of us who are working in American healthcare remain hopeful that that political landscape will allow the parties to come together and to think about how to make really needed improvements in the Affordable Care Act for the betterment of the people that those political leaders serve.
But Lipstein says while Obamacare isn't perfect, 14 million more Americans are insured under the plan.
So doctors and patients have to cope with the hand they're dealt. But in Missouri, we didn't get all our cards.
And that is something voters will remember.
Didn't get all our cards. Sean Callebs is here on the set with us, back from St. Louis, here in the Washington Broadcast Center. You mentioned, in fact, that graphic, startling when you look at how many states are in and out. Why is that?
Well, it's interesting because
a lot of lawmakers, state lawmakers, federal lawmakers believe that Medicaid is simply run very poorly, a waste of tax dollars. So their way of showing, if you lack of a better term, the administration that we're not going to be held hostage by Obamacare, by the Affordable Care Act, we're going to push back and not burden our taxpayers even more by taking this Medicaid. But in the long run, it's really patients that are being hurt, according to the doctors that we talked with. There's still 15% of the people in this country who don't have health care. Now people who had pre-existing conditions can get treatment. So you can't just rule out helping the poor. And that's the argument we heard again and again talking with people. The question is, will those voters turn out and will it have any impact?
Yeah, boy, the comments from that one atrocious, embarrassing disparities, she really kind of hit it. Let's talk a little bit about public opinion on, as you refer to it, Obamacare. A lot of people call it that here in this country. About half of the people opposed it and have opposed it since it was passed. That's held true to today. 51% of Americans oppose it. A lot of them, as I said before it was even passed, didn't like it. 38% now in favor. But some Americans say the law is just too big. There's just too much in it. It's so big, in fact, it's going to take until 2022 before it's completely in effect. How complex is this law?
It's incredibly complex. And in talking to the doctors, they're frustrated not just with all the issues that come with the Affordable Care Act, but just health care in general. But you talked about some of the things. Let's talk about it. To me, it's kind of interesting because a lot of major corporations in the United States, they don't offer health care to their workers. That is going to change under this. If you have more than 50 employees, you must offer health care. So doctors say that's going to be a benefit. It's going to help people. Some of the more odd things from the outside, tanning booths, they're now going to be hit with a 10% tax. The reason, if you lay under those things and bake and try to get an unhealthy glow, chances are you're going to need medical treatment down the road, basal cell carcinoma, kind of skin cancer. So that money is being put in there to help pay for things like that. 60% of the bankruptcies in the United States come from people who have been saddled with overwhelming medical bills. So something needs to be done. Is this the answer? Everybody we talked to said no, it's not perfect. The problem is they're too polarized in Washington, D.C. to open this back up and make some very logical decisions and change the Affordable Care Act. Will that happen after this election? That's what some people are hoping, but it's a bitter fight that's not going to end anytime soon.
Yeah, very complex, no doubt about it. Thanks so much, Sean. Really appreciate it.